With Wayne State, they like, okay, well, yeah, you got into college, but we're gonna show you how to stay in college. We're gonna show you how to help other people in college. We're gonna introduce you to some things you ain't never seen before. I feel like Wayne State is just a big melting pot of everybody.
A lot of our students are working and pursuing their education at the same time. I was a young mom and pursuing my degree as well as, starting a family, so that's definitely relatable.
I wake up around 5 o'clock because I gotta get ready first. In order for me to get my little brother ready, I gotta get ready. I have step team, I have mommy duties with my little brother, I have daddy duties with my dad, I have work, I have 3 jobs, I have to study here at Wayne State.
We are always mindful of the diverse student population that we serve. We learn of their needs from the students in order to tailor the programs that best support student success.
Students were having a hard time making time to come to tutoring, and we weren't really reaching them through the traditional methods. Our tutoring integration essentially just maps students to our tutoring options automatically based on their schedule. We were able to make it really feel like a part of Canvas. We're really proud of it. I mean, it's really increased the number of students who come to tutoring.
It takes a lot of courage for students to seek help. So when students come to us, we want to make sure that we provide that positive experience that students will return.
If you needed help, you had tutors on board all the time, sitting in the library waiting for you, just want you to come, coming to you like, oh, you need help? What you need help with? That was the first time I ever heard someone tell me, what do you need help with? It made me want to go, because now I feel like I have a friend.
The big change we've seen is more interest in coming to the tutoring center, more attendance, hiring more tutors. To me, if you have to hire more tutors, that's a really good problem, because that means the students are coming to tutoring and they're getting help.
When we talk about the increased usage in tutoring, for example, that can have a very high correlation to our retention and our graduation rate.
They are the future. They are invested in learning, and we are charged with being good stewards of their learning process. So unless we are connected to their concerns and their real world challenges, then I don't think we're really doing our jobs.
Why do it? Because everybody is looking at you. I know kids look at me because it's the fact of the matter, I'm setting an example. See me walk across, they saying, oh, she got on a cap and gown and she black. Oh, she came where I came from. So if she can do it, and she came from the same block that I came from the same city that I came from, oh, I know I can do it. Oh, she make it look good. Oh, we can do it.
Here in Detroit, there's endless opportunities.
You really start to get a sense of community.
Wayne State School of Medicine.
I love what I do right now.
If you are looking for advantages that come with being in an urban city, if you're trying to accustom yourself to a fast-paced life, this is where you should be, definitely. This is where you're going to get it all.
If someone were to come to Detroit now without any preconceived notions of what it is, I think they would find that it's just a really cool place to live.
I love living in Detroit because it's my home, and home is always where the heart is. And having the opportunity to go to Wayne State, I can still always have passion and see the city thrive, whether it's education or even culture. People like coming and hanging out at my place because I'm right at the heart where all the action is. From the next concert, sport venue, hip restaurant, bar, you name it. They can always come to my place, and then we can always have more fun time at midnight.
Wayne State does not try to create walls around its borders. Wayne State's intention is to be part of the local community.
Order and ask the secretary to call the roll.
Okay. Governor Barnhouse? Yeah, I didn't see him either as I was going through. Governor Briswito?
Here.
Governor Gaffney?
Here.
Governor Kelly?
Here.
Governor Kumar? Governor O'Brien? Here. Governor Stancato,
Here.
Governor Thompson.
Here.
The quorum is present, and now I will check off, step off to call the others.
Okay, great. We'll go ahead and proceed.
They are both here now, so.
Okay, great.
Governor Barnhill, can I just get you to say here for me? And Governor Kumar? I see you, I just don't hear you. You're muted.
I'm here, President.
Perfect, thank you so much.
Okay, great. Okay, I'd like to ask for approval of the consent agenda. I need a motion that the Board of Governors approve the consent agenda as presented. That first will be the approval of the official proceedings of May 1st, 2020 and June 5th, 2020. One was a regular board meeting on May 1st, and the June 5th was a special board meeting. Personnel recommendations. I just want to call your attention to two items on the personnel recommendations. First is the appointment of the new dean of the graduate school, Amanda Bryan Friedrich, which we previously discussed. And secondly, the appointment of Jack Sobel as emeritus dean in recognition of his tremendous service to school medicine and the university. And then from the Academic Affairs Committee, establish of new graduate certificate in nonprofit management, establishment of an online graduate certificate program in healthcare ethics, request to extend suspension of WSUCA 2.34.090.020, which is the admissions test requirements. That is constitutes the entirety of the consent agenda. Would somebody like to make a motion?
Yes, I'll move that the board approve the consent agenda.
Support.
Okay, it's been moved by Governor Kelly and supported by
Governor
who was
Stan-
that?
Governor
Governor Stancato. Okay. All in favor?
Aye.
Any objections? Great. Okay. Moving on. Usually I do a presence report at this time, but in lieu of that, given the situation that we're in right now and the fact that we won't be meeting until September, and by then some decisions will have been made regarding online versus in-person classes and those kinds of decisions, which have to, if the school will begin again in the fall semester in the mid to late August. I thought it might be a good idea to talk a little bit about the Restart Committee, and specifically we have 9 different subcommittees, but some of the subcommittees are going to report out in a very abbreviated fashion what's been going on in their specific subcommittee. I formed this committee it's called the Coronavirus Campus Restart Committee. I formed it in mid-April. It was April 16th. And really the charge is for developing plans to phase in campus operations consistent with the easing of the pandemic restrictions. A couple of things that I think are important to continue to keep in mind, in that we are, in terms of also some policies that we're working under, is first of all, social distancing is still essential to prevent the spread of COVID-19. And right now, we're telling our employees that if it's possible for them to work effectively from home, to do so, despite whatever the phase we might be in and whatever the governor's directives may be. If you're able to work from home, we want to try to keep traffic on their campus as low as possible during this time. And so we're encouraging employees to continue to work at home. In terms of campus visitors, we're also restricting visitors on campus for now to those who absolutely need to be here for business reasons. And then in terms of the return to work, we're going to do this in a slow, careful fashion that prioritizes safety. Everyone must comply with our return to work guidelines, which are on the university's coronavirus website. Specifically, before employees can return to work, they must obtain approval from their supervisor, complete online training, complete a daily health screener starting 2 days before coming back to work. Of course, we're going to be open in the fall. That's a bad terminology, I think, in terms of talking about whether we're going to be open or not, because we were never actually closed. But the decision that has to be made is whether we'll be predominantly remote and online or predominantly face-to-face. I anticipate that we'll have a combination of all three modes of instruction. At some point, we'll have to be more specific, and we think that by mid-July that we need to have worked out, which courses can be done safely on campus, and which ones would be better if we continue to do those online or remotely. And so we'll be making that decision sometime in the mid-July time frame. But our feeling is that we don't have to make it right now. That we have to continue to be guided by what's happening in terms of the science and public health. And we've got a little bit of time before getting to that level of specificity. So with that, each of the subcommittee chairs, or at least 6 of them, I think, of the subcommittee chairs are going to give a brief 2 or 3 minute update, but all of the subcommittee chairs are on Zoom or Microsoft Teams, whichever we're on, and available for any questions you might have. If you didn't, it doesn't have to be the ones that are necessarily presenting. And we'll start with Dean Lori Clable from the Public Health Subcommittee. This is a subcommittee that we've been leaning on very heavily because this is the subcommittee that is keeping track of the science and keeping track of the public health and keeping track of all the latest developments in terms of testing and policies and procedures from CDC and other places. And so we're leaning on them very heavily to advise us. So with that, Dean Clable.
Thank you, President Wilson.
Lori, hold on just one moment. We're going to post the presentation.
Great.
Michael, would you please post it? Michael, can you advance the slides or give me control, please?
Great, Julie, we can go to the next slide. Thank you again. It's a pleasure to be with you this afternoon. I wanted to just make note of the membership of the Public Health Subcommittee. And as President Wilson said, we have the advantage of being on our Research One campus, where we have access to national experts on infectious disease and epidemiology, excuse me, and on our campuses, they are also folks who have led COVID-related experts in our local health systems, and they have been incredibly generous with their time and effort. We also have representation from the Faculty Senate and the Student Senate on our committee. And next slide, Michael.
Sorry.
There we go. So, as the President said, he refers to the Public Health Committee often as the Subject Matter Expert Committee, and we've been asked to do 2 things, really. The first is to provide guidance to support the recommendations of each of the other Restart subcommittees, and the other is to present a campus-wide strategy for testing, symptoms, mitigation, contact tracing, to support a safe return to campus that is sustainable over a long period of time, and also nimble enough to be able to adapt as the science evolves. As the President mentioned, we're working on a phased strategy that, at least in this initial period of time, minimizes population density on campus. The challenge, of course, is that the science is rapidly evolving, but the good news is we're not doing this alone, and we have recommendations from a variety of both national and local organizations to support us in this work, along with access to the science. But particularly, we have been leaning on guidance from the Centers for Disease Control and Prevention, as well as the American College Health Association. Next slide, please. So as you can imagine, there's been lots of work done on this committee, but I really want to highlight very briefly just a few initiatives in each of three fairly important work streams for us. The first is something we're calling Warrior Safe Training, and this is a common series of educational modules that everyone, faculty, staff, students, will be required to do prior to physical presence on campus. We often think that we have really in this battle two enemies. One is the virus, and the other is almost rampant misinformation about both transmission and the nature of the virus, the severity of the virus, and it's been very helpful to have a constant module, a consistent module that gives everyone a common lexicon and a common understanding of the strategies that we are proposing to keep the campus safe. To date, over 2,000 people have completed Warrior Safe Training, and we've gotten a lot of positive feedback on the course and its ability to help people understand what's expected of them when they return, and a greater understanding of how to live their lives in the time of a pandemic. We are also obviously recommending a number of public health practices. We have adopted a CDC-based screener that we are calling the Campus Daily Screener. People are required to do it beginning 48 hours before their physical presence on campus, and then every day when they return to campus. If they screen positive on the Campus Daily Screener, they are referred to the Campus Health Center for further evaluation, and Campus Health Center does the vast majority of that evaluation via telehealth visits. We are also able, because of the screener, to aggregate data for real-time tracking of the health of campus. This will allow us to assess the incidence of any outbreaks or clusters before they might otherwise become apparent. For testing, as you know, the literature and the science around testing is evolving. Currently, our recommendations are following the CDC and ACHA guidance, and we will adapt those strategies as their recommendations change. Currently, we are doing diagnostic testing for symptomatic individuals, and we are recommending testing universally for those who will move into campus housing because of the unique risks of congregate living. All of our Campus Health Center staff have been trained as contact tracers, and they are following CDC protocols for assessment, quarantine, and mitigation, and they are doing all of the campus-facing contact tracing in conjunction with the local health department. And then the social practices that we have adopted are probably well known to all of you. Face coverings at all times while in public places on campus, social distancing, including 6 feet of distance, reducing our elevator capacity, reducing our use of shareable devices to the degree possible, things like shareable pens and paper sign-in sheets and shared coffee makers. In some places, the directional use of high-volume stairwells and hallways, while there's limited risk of people both wearing face coverings, passing each other in very short duration in a stairwell or hallway, where there are exceptionally high volumes, that may be different. And then our recommendation, of course, to limit in-person gatherings, that we are talking about class sizes of, at the moment, no more than 30 in person, even when social distancing can be maintained, that our meetings be conducted wherever possible by virtual methods, even when folks are in the same building. And I think that's the quick and dirty highlight of the work of the Public Health Committee.
Thank you very much, Dean Clayball. I see Rob Davenport on one of the screens here. So he heads up the facilities and buildings committee. So Rob, can I ask you to go next?
Actually, we have an order of these, Roy, and so Keith Whitfield is actually scheduled to go next.
Okay, well, then maybe you can tell me what the order is. It's Keith and what? Who else?
I think that they have the order in front of them, and the slide presentation will kind of give you that.
Okay, Keith.
So to answer to the next slide. So ours is the Teaching and Learning Restart Subcommittee. We are composed similarly like the others with faculty from the Academic Senate and other places. Part-time faculty are represented, staff are represented, as well as administration. So just a very brief overview of some of the things that we've done. I think we started off with a town hall. I think the committee is very committed to communication. That's one of the things that we hear constantly is that the more they know, the more comfort people feel. Even though we don't have a strict plan, that plan is in the making. We started off with a town hall just to talk about some of the things that have been discussed, some of the timelines that we were going to have. And we also did a short survey. And one of the questions, it was only 3 questions, but one of the perceptions was about how comfortable you felt with coming back to in-person instruction. And we had a pretty large group of folks at that time who were not comfortable coming back. We also had a flyer about conversations about instruction. One of the challenges is trying to do what the president mentioned, which is establishing what courses would be in-person courses. It's not to bias, but laboratory classes, performance classes are ones that have a great amount of need for in-person clinical classes. And what we wanted to do is to make sure that faculty, chairs, and deans were all having a conversation about which of those classes actually should be done in person, and trying to follow the public health group suggestions of trying to then do the rest remote. We're just about finished. I think it's probably going to take another couple of weeks to get a clearer picture, but around now we're at about 50% would be remote. I think that there's about 25% that is in person, but we believe that number is high because people just haven't figured out how they would convert their courses to remote. So we think that's going to go down a little bit. And then there's other types of courses, including some of our online courses that we already have. I really do want to make the difference between remote and online. Remote is done synchronously at a specified course time, and the class then meets at that time, versus online, which is done asynchronously, and when the student wants to get on and actually follow the course at their own pace. There are also individual courses like dissertation hours and credits, and that makes up another 5% or so. So that is flushing out, and hopefully in a couple of weeks we'll have a good idea of just how that's going to work. Some of the discussions with other committees is one of the things that we've taken on because we wanted to make sure that we coordinated communication and even thoughts, talking about the logistics of PPE and classroom management, about facilities. The Code of Conduct had input from this committee, and also discussions about compliance in public health spaces is still one being discussed. We also took a look at possible adjustments to the academic calendar, and our decision came down on that is that we didn't see one that looked like it was actually going to work for our campus. You may have heard this from other places that they're thinking about canceling after Thanksgiving. Those tend to be large residential style campuses and would not really be maybe a big shift in terms of the number of remote classes we're already doing, and a difference in terms of being residential versus where they are now is that, we have a lot of students that are commuter students. Next slide, please. Next slide, please.
Sorry.
So very quickly, the tentative plan is that June 15th, we've got the data in to get the proportions of types of instruction for the fall. On the 22nd, we're going to be doing another survey to faculty, staff, and students to talk about concerns, perceptions, and needs. On July 15th, that seems to have become a universal day to try to make sure that we share with the university community about instruction types, making sure that we encourage them to go online and make sure that their course that might have been in person to see if it's going to be switched to remote or not. We're working on a piece to provide suggestions for syllabi to make sure that students know the resources, the changes in student code of conduct, those sorts of things. And we also want to provide support for reducing the digital divide. This happens for both faculty and staff. What we observed in the winter semester is that some might not have had a computer, and then even to some degree, people did not have adequate Wi-Fi and internet services. And we're working on thinking about ways in which we can make sure that we support those students with either a mixture of providing them things called hotspots, or being able to have them come back physically on campus and to be able to use facilities that are there. So in the fall, we'll be offering remote, online, and in-person instruction. We'll be monitoring to make sure any possible changes that may come up. If you think about the winter semester, we went from in-line to remote. And to conclude, I'd just like to say that there were three entities that made that shift probably better than many universities were able to do, because I've talked to many of my fellow provosts, and they talked about the incredible disruption. For us, it was the ability to have a fantastic Office for Teaching and Learning, which helped faculty be able to figure out ways to move their courses remotely during that span that was near spring break. It was our CNIT folks who actually made sure that they were there to be able to provide resources, both in terms of instruction and assistance, but as well physical computers. We were able to give some of our students in need, loan them Chromebooks. That was something done between the libraries and CNIT and DOSO. And the other piece was our faculty. They stepped up in ways that were absolutely amazing and incredibly encouraging in a very short period of time. They were able to make it so that we do offer quality instruction, and that I don't think that there was a loss in terms of switching, which is one of the concerns, that remote sometime would not be the same level of quality. But I think that our faculty ensured that actually students definitely got what they were looking for in terms of an instructional opportunity. And I'll stop there. Thank you.
Thank you. Could I have whoever's up next?
It's Steve Lanier.
Okay. Dr. Lanier?
Are you on mute, Steve?
Not anymore. Okay, thank you. Yeah, so we have had we've actually been involved with a series of processes that went back to March 11th. So we ramped down, we paused, and now we're involved with the phased resumption of research activities, on-site activities. The task force tasked by President Wilson involves 11 faculty, all of whom are funded investigators with active research programs, representatives from the Academic Senate, as well as a range of support personnel that would touch the research infrastructure. We began meeting on this, I guess, as a core group around 3 or 4 weeks ago. We have lead representatives from the major research-intensive colleges that have on-site wet lab activity, includes medicine, pharmacy, and health sciences, College of Liberal Arts and Sciences, engineering. And we started as a ramp-up plan, I guess, around June 1. And over the last 3 weeks, we have a phased process where we've tried to initiate activities at a level of about 25% of the activity pre-COVID, consistent with what you've heard from my colleagues in terms of a phased process. We've worked closely with facilities, public health committee. Every individual that's coming back on campus has to submit a plan that is then vetted by the department chair, is then vetted by the vice dean for research in the particular college, and then by my office as well. And so through that process, we've now activated research labs activities in 20 buildings across campus. including medicine, pharmacy, health sciences, college, liberal arts and sciences, and engineering. We've actually activated now, I think, at last count, 295 individual laboratories scattered across those facilities. And again, they're all operating at a reduced staffing level. During this process, we also put in mechanisms for people to convey their thoughts that were they comfortable in this environment, not comfortable in this environment. We also provided every individual coming on campus with 2 cloth masks as they came on site. We secured sanitizer for all the labs. We also secured disinfectant together, EPA-approved disinfectant from facilities, so that every lab is supplied with these materials when they come on board. We've also set up together with Public Health Committee and the IT group a barcode scanner. As individuals enter the building, they're required to complete that scan to document that they completed the campus daily health screen. The last thing I'll mention is that we also have phased-in surveys that the different units are conducting to determine how this worked, how that didn't, how that worked, how they feel comfortable, etc.
Okay, you done, Don?
Yes.
Okay, I think Rob Danforth is next now.
All right. Thank you, Mr. President. So on the facility side, we've been developing a playbook that is a very prescriptive document outlining all of the actions that we're taking to, in fact, create an environment that is safe for occupants to re-enter. The draft is complete. We've got a few edits that we need to do, so we expect the published version to be available next week. It took several weeks to put this together, and we enjoyed great collaboration across, all university stakeholders. The playbook has 8 sections. There are 46 pages, and this is truly a guide for all campus occupants. We are also creating an FAQ associated with this playbook, and again, the elements of the FAQ will be based on the points within the playbook itself. So you can see the 8 sections that we've got inside the playbook. I won't read them all here. They're all in front. So also like to mention that we put a primary focus on research efforts, as Dr. Lanier has just described, the classroom piece, athletics, and libraries. Go ahead and advance the slide. I'd like to focus on 3 sections within the playbook: custodial services, space planning, and construction. With regard to custodial services, we have trained our staff to understand how to clean both on the preventative and post-case pandemic side, and this would be in classrooms, offices, restrooms, etc. And frankly, the training is largely based, bloodborne pathogen type training, which all custodians have already. As I've mentioned, we've developed prescriptive content around cleaning in various areas within the campus. We've outfitted the campus with nanoseptic films, so actually we've begun doing so. And those are applied to door handles and elevator buttons and such areas where they literally kill, biohazards as they are applied to the nanoseptic product. Also, we've procured the Clorox 360 electrostatic fogging machines, so we've got 2 of those on site. These will be utilized for post-case sanitation and also preventative sanitation in the athletics and fitness centers. On the space planning side, as the Provost mentioned, we've been in collaboration with the academic side to perform fit testing in classrooms, and then also, do furniture layouts, traffic flow, and other situations of the like to again provide social distancing. Queuing has been developed in classrooms, as well as so we're working on elevator lobbies for queuing as well. And of course, we're encouraging folks to use. Construction piece is noted here below, but I would like to put an emphasis on indoor air quality indoor air quality is an item that is addressed very prescriptively again in the playbook. So I would encourage everybody to have a look at that again next week once that's out for publication. So that's it on the facility side.
Great. I think housing is next. Yep. Jim?
Thank you. Good afternoon. The Housing and Campus Retail Group is a very large, broadly representative committee with almost 30 people, students, faculty, and staff, and our university business partners. We have benefited from and continue to enjoy the high level of cooperation you've heard already talked about between all the other committees. And so our charge was really to take the best practices that were being developed in facilities, in the Health Policy Committee, and to apply those to student service areas on the campus. Housing, obviously, but also many of our retail locations, the campus bookstore, the student center, which is a major gathering point for the campus. We did a lot of that really thinking about not just actually being safe, but we also want people to feel safe in those spaces. And so to that end, we also spent, and I continue to spend a lot of time working both with our individual groups and with central marketing about a very consistent signage campaign across the campus so that as students, faculty, staff move through the campus, they're seeing consistent messaging. We are doing our work in 4 different subgroups, one focused on auxiliary facilities.
Sorry.
It's okay. One working specifically on dining and other retail services, the WSU Housing Corvius Housing Partnership, and then resident student development, that education process that we still believe will happen this fall on campus. Next slide, please. So throughout, what we're really trying to do is, as we make decisions, to be very transparent so that students can make choices fully informed on how they want to engage with campus for the fall. We want to share with them all of the requirements that you've heard mentioned from the other committees, all of our mitigation strategies, and have them fully understand those so that they can then make an informed choice about how they want to interact in terms of meeting those expectations for participation, living within those environments, which I'll talk a little bit more about in just a minute, and then also making decisions about interacting based on their own personal health circumstances. So we want students to understand fully how they will engage on the campus if they choose to do that. And I mentioned that we're doing all of that information sharing through a variety of virtual town halls, weekly seminars. We're doing virtual tours, web chats, emails, postcards, all of our social media. We had our first housing town hall meeting on Tuesday with about 500 participants who sent in over 250 questions that we worked at for the first hour. Yesterday was a webinar discussing our new dining programs and how dining will be different for fall. And we have a series of programs scheduled every week to talk about the student service areas on campus. Next slide, please. So specifically for housing, I won't read all these to you because many of these are talking about the mitigation strategies that were already mentioned by Dean Clavo and by Rob and facilities. We are requiring mask use, that facial coverings be worn in any of the locations except if you're in your own private space. Let me start with move-in and just say that normally we have a very busy, crowded 2-day move-in period, and that will be extended in August to probably 7 or 8 days to accommodate physical distancing. All students will make an appointment to move into their rooms this year instead of coming in chunks of time, and that larger move-in time will also allow us to accommodate the testing that is going to be required of all students who are moving into campus facilities. We have over 500 students living with us now in the summer, and we're going to be perfecting some of those fall strategies by working with the current students. And so the summer residents will also be tested probably in July, and that will help us determine the best testing process for the fall as people move in. Social distancing in the buildings are important. You've heard about limiting traffic in hallways and in elevators. We're removing furniture from lounges so that some of our spaces can be used, but they'll be reused. They'll be usable with restrictions on the numbers of people involved. We are continuing with our suspension of our guests and visitors policy. We eliminated all visits to our housing facilities in March when the pandemic first came to campus, and that was a very effective way to control introduction of new individuals and potential infection. And so we're doing that this summer, and we'll continue that in the fall. We'll be using best practices at all of our service areas and points of sale, both in housing and dining and other places, protecting people with plexiglass screens and emphasis on contactless transactions. We know that there will be students on campus who do become symptomatic or will be exposed to someone with the virus, and so in each of our housing facilities we have designated isolation and quarantine locations, and we are working very closely with the Campus Health Center, continue to revise our protocols about how we will daily, and the Campus Health Center will help us with this, daily interact with those students to make sure that they're supported while they stay in those quarantine spaces. We've already had a student this summer. She just emerged from isolation on Wednesday after successfully, completing her evaluation with the Campus Health Center. So lots of signage. And then the other thing that you're hearing many schools do is reducing occupancy in buildings. That's, again, trying to emphasize physical distancing. With the benefit of the opening of Chatsworth Suites this fall, which has been closed for the last year for renovation, we're adding another 350 beds to our capacity. We don't expect to be full this fall, and so we believe that by spreading out our vacancies, we can reduce capacities in each building, especially on the upper floors where the demand on elevators are greater, to help us minimize the overcrowding in the buildings and to support the social distancing pieces. Next slide, please. And then related to dining and retail, similar to FP&M, each of our university business partners and our businesses working in leased spaces have created playbooks of how they are reopening their businesses and then how they will operate them using mitigation strategies consistent with all the recommendations. We're doing quality control on those to make sure that they are in fact following the best practices. What's been great has been that our larger franchises who have more robust, complicated playbooks are sharing those best practices with some of our smaller businesses so that everyone has the advantage of the best information. Dining will look different this fall. We are going to allow some in-room dining if students want to eat at the cafeterias, but we've reduced the occupancy of the cafeterias. The students will wear masks while they get their food. We've organized all of the food distribution differently for fall in the Towers Cafe, Golden Greens, and the Student Center food court. And students will remove their masks only when they actually eat their meal, and then we'll put their masks back on anytime they leave the table. We believe to-go programs are still going to be very popular, and we ran those extensively in March and April. And so those to-go meals will be available at all meal periods on the residential dining program, and we're adding an additional to-go program location in the student center so that if to make it easier for students who have meal plans to get to carry away food from the different meals. And you can typically get more than one meal period at a time. If you want to pick up your breakfast for the next day while you're at dinner, you'll be able to do that. And then there's really we're moving as quickly as we can with some of our technology to emphasize contactless transactions. So we're looking at how the one card is used, how you access dining in some of our other locations, and how you make purchases on the campus. So we continue to evolve all these. We're watching closely. We did extend the contract cancellation deadline is normally June 30, but we've extended that to July 20. which is after the July 15th deadline, when we should know how all the courses are going to be instructed. Students are very interested to know how their courses are going to be delivered, and that will help them make their final decision about whether to keep their current housing contract, sign up for a housing contract, or cancel their contract. And so we're trying to be as flexible as possible, and it goes back to what I started, which was we're trying to communicate as much information to students so that they can make their best informed choices.
Thank you, Tim. Last is Human Resources with Carolyn.
Thank you. Good afternoon, everybody. The HR Restart Subcommittee is another very large subcommittee made up of members from our faculty, including the Academic Senate, various areas of our staff and administration, and union representation from both our academic and non-academic unions. Our charge was to develop a phased approach for restarting limited, as needed, on-campus operations, to review our policies and procedures, to identify any new that may be needed, as well as revise existing policies and procedures for our new normal. And then also, like all of our other subcommittees, to help ensure a safe and efficient transition for all of our employees. We have 8 work groups, as you see listed there, but I will only highlight some of the work from 4 of them. Next slide, please. So first is our framework work group. This group has worked very closely with our training work group to develop the leaders' return to work guide and checklist, which I will talk a little bit more about under the training group, but that will be coming out in the next week or so. We have a great first draft, and it's really designed to help leaders develop their restart plans. But we are planning on 4 additional phases. The first phase was, of course, the research in our laboratories, and then phases 2 through 5 really involve planning for restart, and then very slowly, about every 3 to 4 weeks, determining who needs to be on campus based on what work absolutely needs to be on campus, because we're continuing to promote, as President Wilson said, remote work. But the return to work guide really lays it all out for our leaders and really puts all that information in their hands. The framework work group is also working on a Warrior Safe campaign. And I won't go into all of it, but part of it is creating a very positive environment that is welcoming to those coming back to campus. And then also allows for a safe place for employees to submit complaints if they perceive that they are in an unsafe environment. And we have collaborated with several areas to create a process that will allow employees to do that, and for those complaints to be handled consistently and promptly. Next is our policy work group. Members of this team had already developed flexible work arrangements to address teleworking and guidelines for supervisors as well as employees, but they have also issued a survey that closed 2 weeks ago to all employees on campus, leaders and staff, to help inform and provide us with feedback on their experience working remotely. And we're going to use that information to help inform and refine not only the flexible work arrangement guidelines that we hope to make policy, but we have also reviewed all of our administrative policies and procedures. And as you can see there's a long list of sections within that manual that we believe will need to be revised, or new policies will need to be incorporated to address our new normal, as well as to address the myriad of regulatory requirements that have come out from the federal government related to things like FMLA and expanded FMLA and the CARES Act. We are also in the process of reviewing our collective bargaining agreements to see how all of these new policies, procedures, and regulations might impact our union contracts as well as our represented employees. Next slide, please. Then there's our mighty training team. This group has really been working hard and collaborating with many people on campus, particularly our public health subcommittee, to develop the Warrior Safe training modules. As Dean Clable said, everyone will be required to complete before returning to campus. They are also the team that has developed an additional group and has brought in a number of our students who were not employed and have given them employment opportunities to help to evaluate the survey responses that I mentioned previously. We have received a 71% response rate. That is phenomenal for any survey. And people have been very vocal about their likes as well as their challenges, and we're using that information again to inform our policies and procedures and what changes we have to make. And now to the phenomenal Leaders Return to Work Guide and Checklist. This team really listened to what we were saying, not only in the framework work group, but also the feedback from the broader HR Restart subcommittee, and have developed this return to work guide that is really what I call one-stop shopping for leaders. It takes all of the information, tools, links, websites, and checklists and put it all into one place where leaders can be guided on the myriad of decisions they now have to make. It's not a matter of just saying, report to work on Monday. As you've heard from the public health subcommittee as well as the facility subcommittee, there are a lot of decisions that have to be made. And there's a lot of work that's gone into developing updated websites and flyers and checklists. And so we put all of this together, and we have various sections based on exactly what work needs to be done. Where does this work need to be done? Does it really need to be on campus, or can it continue to be done remotely? And making sure that all of the decisions that leaders have to make are right at their fingertips. And we are suggesting that leaders begin looking at this now, not waiting until August or September when the term is starting, but they begin working on this now. And so we've got a great draft. We also have a number of leader as well as employee guidance that's already on our website for people to get a sneak preview and begin to thinking. We'll be vetting this guide and checklist through the other subcommittees to get their feedback, but it's our goal to deliver this to leaders by the end of this month. The training group is also working on developing a great remote working training module that'll be available through Accelerate Online that will address working remotely, leading remotely, conflict resolution, and all number of other tips for working remotely. This team has also worked very closely with other members of my HR staff, from my executive assistant, our talent management coordinators, to turn our what had been in-person new employee orientation into an online experience. And they're also will be working on creating Welcome Back Warrior videos so that leaders can email it to their teams to show them what their new office environment will look like. And then last but not least is our health and safety team. They have been working very hard in collaboration with several of our external third-party vendors to deliver a myriad of wellness seminars and webinars, all surrounding physical, mental, and financial health and wellness. We began distributing a monthly Life Advisor newsletter the 1st of June. That will come out monthly from the Alliance, who manages our employee assistance program, and we'll have a calendar of events that will be provided to our employees. That has already begun, and people are already taking advantage of those webinars as well as private consultations, because we want to make sure that as our employees return to campus to do work, that they are also have their mental, physical, and financial needs addressed as well. And then last but not least, I am really excited to tell you that we have launched in early June the Shared Illness Pool,
what this is we have had, and these numbers were provided to you at the point that we provided the board documents, but I would prefer to tell you where our numbers are today. Today we have approximately 160 faculty and staff who have donated some of their sick time hours, totaling nearly 22,000 hours, to be available to employees who may not have sufficient time if they get sick from COVID to cover 14-day isolation or quarantine, or in some cases, people have been sick for far longer than 14 days. And so we don't want folks to have to go unpaid and then have their medical bills, medical benefits put in jeopardy. So they can request time from this shared illness pool. To date, we received 2 requests just this week. And so this is has been very well received, and we're very pleased to be able to show how we support each other. And that's all I have for now. Stay tuned for more.
Great, thank you. I know that this took a little longer than most of the President's reports, but I appreciate the board's indulgence. I think this was important to go through, given that we're not meeting until September. Does anybody have any questions before we move on? Governor O'Brien.
Thank you, Dr. Wilson. Have we made, maybe I missed it, but had we made a decision as to whether we're going to require our students to have their own PPE, or whether we're going to be providing masks for students?
Yeah, my understanding is we're providing the mask.
Okay, all right, very good. And then I'm assuming hand sanitizer at every entrance to the hall, residence halls and everywhere. Okay, got it. Thank you.
I have a question. President Wilson.
Oh, yes, I see you.
Yes. And you might hear some lawnmowers and stuff in the back, so if you do, sorry about that. But the question is really about testing and tracing, and you said that you would be testing students who are in the residence halls, and then I can't remember who else you said you would be testing, but is there a plan, and do public health experts think it is necessary to test faculty, staff, others who are on campus to, prevent the spread, given that there's 27,000 people on campus?
So I can answer that question. Thanks, Governor Thompson. The current recommendations from both the CDC and the American College Health Association are that we do testing only on symptomatic individuals and on high-risk individuals, meaning those who live in congregate housing. Our plan goes a little bit beyond that, and we are recommending both diagnostic and serologic, so antibody testing of a random sample of people across employment groups on campus on a voluntary basis, probably 200 to 300 people, and we will retest a sample every 4 to 6 weeks. That really gives us a great measure of the health of the campus. Similarly,
and then go ahead.
And similarly, residence housing, while we test everybody at move-in, that is a one-time snapshot and it's a diagnostic test. We'll be retesting them on a recurring basis. And as President Wilson has been very interested in, we're now looking at pool testing for groups of students. That will allow us to do even more frequent testing.
Okay, and that's obviously subject to change if there's
Absolutely.
a second wave or something.
Absolutely.
Okay.
Okay. I don't see any other questions, so maybe
I have one, just a quick one.
I'm sorry. Who's that?
Marilyn, this is Marilyn Kelly.
Oh, I see. Okay. Yes. Governor Kelly.
Not really a question, but a statement. If board members haven't seen it, I suggest that you really profit from looking at the screening module that everybody's asked to go through every day before they come on campus. And also there's a training module about the disease that I went through and took, and you have to pass this before you can get admission back into any of the campus buildings. And I was very impressed with both of those. I want to congratulate staff on this.
And I see Governor Basuito had a question.
Yeah, just one quick question. You know, when I go in the hospital every day, and they use automatic scanners to tell if you've got an elevated temperature, and you have to fill out a questionnaire. But I know Dr. Fauci said when he goes out jogging outside that he doesn't wear a mask. I'm just wondering, is it necessary if the students are out and about on campus and they're not in closed groups? I'd like to know from Professor Claybo, does she think they really need to wear a mask under those circumstances?
So our recommendation is obviously public spaces indoors, it's a requirement. Public spaces outdoors, where people can maintain 6-foot distance, it's less of a requirement. However, the concern is once we move to a larger footprint on campus, as you know, Governor Basuito, it will be more difficult in a more congested area to be able to maintain that. And then we would move to requiring masks.
Thank you for that.
Okay. Seeing no further questions, we'll move on. I know this was a little bit longer than usual, but I thought it was important for the board to see the scope and scale of this work. So two of the board's standing committees met earlier this morning, the Academic Affairs Committee and the Student Affairs Committee. So I'm calling on Governor Gaffney for reports from the Academic Affairs Committee.
Thank you. As you stated, we met this morning. We considered 3 action items, all of which were included in the consent agenda that we previously passed. There were no presentations scheduled for today's meeting, and those 3 actions concluded the agenda. The committee will meet again in September. Thank you. That concludes my report.
And then the other committee that met is the Student Affairs Committee, and I call on Governor Stancato for a report from the Student Affairs Committee.
Yes, the Student Affairs Committee met this morning, and we had 2 presentations. One from Senior Associate Provost for Student Affairs, Monica Bachmeyer, and then from our General Counsel, Lou Lester. And this morning was the annual presentation of student success, which happens every year. And Associate Provost Bachmeyer talked about the university's continuing track record in terms of improving graduation rates. And I want to emphasize the word improving. One of the things that we can really be excited about is that we had a goal of 50% overall graduation rate to be reached by next year, and we've reached it already at a 50.5%. So we're above that goal, and it's always good to be able to reach your goals, but being able to reach them early is a good deal too. The other thing we talked about was African American graduation rate, which increased at almost 24%, and also that's the 6-year graduation rate, and the 5-year graduation rate was at about 25%. I think the other thing that's important to look at is the retention rate. That was an issue too, and the retention rate across the board for all students really either stayed flat or moved up a bit, and so we really are directionally correct in terms of our focus on students and student achievement. The other piece that I don't think we talked enough about is that success is important, and everybody contributes to that, but I don't think we should forget about the fact that our faculty members have an awful lot of impact on the success of our students. So with graduation rates improving, then I think the faculty can also pat themselves in the back in terms of their role in that. And then in terms of, we spent, Associate Provost Bachmeyer spent some time talking about all the things that happened around COVID-19, the pandemic. Really excited about how our students pitched in from across the board. There were coordinated efforts, great team, and there were about 60 continuity plans for advising and other academic service. And again, I think we can be proud of that. There are a lot of things that were brought up over the course of her presentation in terms of the fact that there are 200 programs devoted to student success. And so that was other things important, but I just thought those were the highlights from her presentation. And then General Counsel Lessem reviewed the Student Code of Conduct, which included some clarifying language.
some of which has been talked about already in terms of the planning to come back to campus, but social distancing rules and other items that are enforceable under the new student code of conduct, and then an issue related to Title IX and the fact that the Department of Education has issued a final ruling which goes into effect on August the 14th, and the changes to the code need to come forward for adoption at this time. And so I'll turn it back over to President Wilson.
Thank you very much, Governor Sancato. So I'm going to request a motion that the Board of Governors revise Board of Governors Statute 2.31.01, the Student Code of Conduct, to respond to the issuance of the final rule of Title IX, recently issued by the United States Department of Education, and to reflect social distancing requirements for reopening of the Wayne State University campus. Is there a motion?
So moved.
Support.
Moved by Governor Sancato and supported by Governor Kelly. All in favor?
Aye.
Aye. Any opposed?
Aye.
Great. Moving on then, this is something new, exciting I think, but the Board of Governors has a new award called the Warrior Unsung Hero Award, and I'm going to call on Governor Kelly for presentation of these awards.
Thank you, President Wilson. Well, this has been an unprecedented time for all of us, and we feel it most deeply here closest to home on our campus community, for the city of Detroit, for the broader Southeast Michigan community. The COVID pandemic has impacted so many lives, the health and well-being of our community, the way we live and interact with each other, how we teach, how we learn. It's been a time of great need, and the board's been impressed and gratified by the way members of the Wayne County community, Wayne State community have risen to meet that challenge. Many stories have come to us about individuals going above and beyond to provide help where it's needed and to deliver that help in a variety of ways. There have been so many examples, in fact, that we wanted to find a way to recognize some of those contributions by members of our community who've answered that call to service. And that's how the Warrior Unsung Hero Award was born. The response to the call for nominations was amazing. More than 120 nominations were received, which is an excellent tribute to the talent and compassion of our Wayne State. So selection from among this considerable group was very difficult. We want to offer our deepest congratulations and thanks to all who were nominated. And I think thanks also to our staff who helped us winnow down that number of 120 to a manageable finalist group that we could pick from. And that, I think the people who worked hardest on this were Carolyn Berry and Julia Haas. And I know that Michael Wright was involved in overseeing, and of course our Vice President and Secretary of the Board, Julie Miller, did, as so often, did all the back work to make this all work out. We will find ways to continue to highlight these remarkable stories in the weeks to come, but today would like to recognize 4 individuals whose work has really made them warrior unsung heroes. So 2 of my board colleagues who worked with me as a selection subcommittee will introduce you to these fine individuals. But the full board joins us in recognition of these truly wonderful contributions. So starting, Governor Gaffney, will you begin by telling us about the faculty recipient of the Warrior Unsung Hero Award?
Thank you, Governor Kelly. The Board of Governors recognizes Suzanne Brown, Associate Professor, School of Social Work, with the Board of Governors Warrior Unsung Hero Award. Professor Brown spearheaded Wayne State University's Crisis Hotline for healthcare workers here in Metro Detroit. That launched in April of 2020. It's a joint collaboration between the university's School of Social Work and the College of Nursing. The Crisis Hotline offers free, confidential support to those doctors, nurses, and other first responders working on the front lines of the COVID-19 pandemic. The hotline is run by trained volunteers, many of whom were recruited by Professor Brown. She continues to teach a full course load while supporting other faculty members in the School of Social Work. When asked about the genesis of this project, Professor Brown stated, "We knew frontline workers were experiencing tremendous stress and anxiety in caring for increasing numbers of very sick people with COVID-19. We wanted to help frontline workers manage their anxiety and increase resilience in the face of extreme circumstances." The Board of Governors is pleased to recognize Suzanne Brown for her heroic efforts as she has stepped up to make a difference in the community.
Thank you, Governor Gaffney, and congratulations, Professor Brown. Governor O'Brien, would you like to tell us about the staff honoree?
Thank you, Governor Kelly. The Board of Governors recognizes David Zarif, Lieutenant, Wayne State University Police Department, with the Board of Governors Warrior Unsung Hero Award. In April 2020, Lieutenant Zarif created the Serving Our Seniors SOS program to meet the needs of a particularly vulnerable population. 3 days a week, he leads members of the Wayne State University Police Department in checking on seniors living in the Woodbridge area near campus. During these checks, the Wayne State University PD officers ensure that the seniors are physically well and determine any immediate needs. Additionally, every Wednesday, officers deliver non-perishable food to the seniors thanks to a partnership Lieutenant Zarif established with Pilgrim Baptist Church. An ongoing program, SOS, will expand to include other needed services to seniors. When asked about the genesis of this project, Lieutenant Zarif stated, quote, "Our seniors who are the most vulnerable to the coronavirus needed an outreach to provide them with the essentials. They were isolated and unable to leave their homes for groceries, prescriptions, or even to visit loved ones. Wayne State PD stepped into the gap to provide some of these services." He added that what better way to help than to look out for those who have paved the way for all of us. The Board of Governors is pleased to recognize Lieutenant David Zarif for his heroic efforts as he has stepped up to make a difference in the community. Congratulations.
Thank you, Governor O'Brien, and congratulations, Lieutenant Zarif. We had difficulty selecting from among a large number of very worthy student nominees, and therefore we're bringing two of them forward. The first will be presented by Governor Gaffney.
Thank you. The Board of Governors recognizes Leanna Foster Bay, MD candidate, School of Medicine, with the Board of Governors Warrior Unsung Hero Award. In April 2020, Leanna created and organized field hand-washing stations around the city of Detroit for those who did not readily have access to running water. Leanna, a class of 2022 medical student, continues to check and refill those hand-washing stations as part of an ongoing effort. A member of Street Medicine Detroit, she is also on the leadership team of the Street Medicine Institute Student Coalition. Upon discovering that the Detroit Police Department has been moving homeless encampments during the COVID-19 pandemic, she coordinated with multiple groups on how to best provide support to any members of the homeless community who have been moved. When asked about the genesis of her project, Leanna stated, "One of the first organizations that I volunteered with in medical school was Street Medicine, and I quickly fell in love with the practice of going to the people to provide quality medical care. In March, as the intensity of the pandemic began to increase, those experiencing homelessness were on my mind, particularly their ability to wash their hands to help protect themselves from the spread of the disease. That ultimately led to the creation of the field hand-washing stations. These were made possible by the leadership of Street Medicine Detroit and a fantastic team of volunteers. The Board of Governors is pleased to recognize Leanna Foster Bay for her heroic efforts as she stepped up to make a difference in the community. I think this is an incredible example of the reach of our students and our volunteers. I never would have thought about hand washing stations around town, but I'm sure it's made an enormous difference. So I want to congratulate Leanna Foster Bay.
Thank you. And congratulations. Governor O'Brien, would you like to tell us about our final honoree?
Yes, thank you, Governor Kelly. The Board of Governors recognizes Rafael Ramos, MD, PhD candidate, School of Medicine, with the Board of Governors Warrior Unsung Hero Award. Since March 2020, Rafael, a medical student in the class of 2022, has been using his 3D printer to make personal protective equipment, or PPE, for clinics, hospitals, and medical student-run free clinics. He has been producing these items from his apartment, personally footing the bill for his ongoing efforts. What's more, he has brought face shields, ear savers, and additional PPE to healthcare centers around Detroit, including the Community Health and Social Services Center and CAF Clinic. When asked about the genesis of his project, Rafael stated that the drive to do something from home was contagious, and my continued interest and previous experience with 3D printing made it easy to jump on the wider online initiative to use this technology to make PPE, in an effort to ensure everyone on the front lines was as protected as possible. I'm lucky that I can continue to be a cog in a wide web of support with help, including the loan of equipment from Cesar Chavez High School, technical insight from the Wayne State University Engineering Studies, and many other groups like Protecting Frontline Heroes, Metro Detroit, and the student-led Detroit Needs PPE, which help determine if and where this assistance is still needed. The Board of Governors is pleased to recognize Rafael Ramos for his heroic efforts as he stepped up to make a difference in the community. Congratulations.
Congratulations, Mr. Ramos. Thank you, Governor O'Brien. And on behalf of the board, we want to again extend our congratulations to today's honorees and to the broader Wayne State community for stepping forward during this incredibly difficult and challenging time. The caring and goodwill of our community is something we can all be proud of, and you honorees have our enduring thanks for all the good work that you do. President Wilson.
Roy, you're muted. President Wilson.
Yeah, sorry about that. We've come to that point where we have information reports from the university administration. We also have some action items for which I'll be asking for a vote on. For the informational items, I'll call on everybody, and if since everything's in the report, unless it's something that you really want to add important information to, don't feel compelled to necessarily talk if you don't have to. Provost Whitfield, Academic Affairs.
Yes, so just a couple of things. I wanted to note that we have lost another one of the Wayne State community in Miss Angela Michelle, who was a social work student and passed away due to COVID. On the brighter side, we have 50 K through 12 programs that are going on this summer, and they're being done virtually. So that great history and connection that we have with the community is continuing on. And then one last piece is that our Kickstart program, which is in part an effort to address affordability for our students, but also to make sure that they get excited about coming to us in the fall, is a program that offers students a free online course in the summertime. That we're up to 728 requests. We were assuming we'd only get 500. So it shows that students are still very, very interested in continuing in their education and also becoming a warrior in the fall. That's it. Thank you.
Great.
I have a quick question thank you, Provost Whitfield, about the Kickstart program. How many students does it serve?
So right now we've been able to find instructors to do about 672, 675, and we're finding one additional one so we can add another section and be able to meet the entire need of people interested in the program.
Okay.
That would be that.
And who are
728.
and who can apply? Who are eligible for the program?
This is for our incoming freshmen.
Anybody, no matter what their grades or anything.
Certainly, if they're accepted to Wayne State University, they qualify for the program.
Okay, thank you.
Okay, I'd like to remind people to put their microphones on mute if you're not speaking. I think we're getting a little bit of feedback. Vice President Lanier?
I don't have anything to add, President Wilson. Thank you.
Okay, there is one action item. I'd like to ask for a motion that the Board of Governors authorizes the President or his designee to contract with Reproductive Stress 3M, a Michigan C Corporation. The contract would be to perform research and laboratory services related to the development and validation of stem cell technology for assessing the developmental toxicity of drugs and compounds, and we need a roll call vote. So I'll ask for a motion in a second and then ask the Secretary to call the roll. Can I get a motion?
I so move.
Okay, I heard a motion by Governor Kelly, and was it Governor Thompson? That's okay, great. So we've got a motion in a second. Will you call the roll, Madam
Yes.
Secretary?
Governor Burnhill? Are you muted, Governor Burnhill? Okay, I'll move on. Governor Briswito?
Aye.
Governor Gaffney?
Yes.
Governor Kelly?
Yes.
Governor Kumar?
Yes.
Governor O'Brien?
Yes.
Governor Stancato?
Yes.
Governor Thompson?
Yes.
The motion carries.
Great. Government and Community Affairs, Vice President Lindsay.
Yes, just one couple of quick notes. One, at the federal level on the Title IX, where our director is working with other universities to try and get rule changes implemented through Congress on that Title IX out of the department. And then secondly, there was a bill introduced in the Senate here at the state level dealing with de-escalation training for law enforcement, and Wayne State was supportive of that, also connecting our center that deals with public safety training to that effort to see if we can help support the initiative. That's it for me.
Okay.
I have a quick question.
Yeah, President Thompson.
Yeah, so do you anticipate any other federal funding coming for universities at the,
Yes, there may be some in the works now, but we're, again, monitoring that. Everything is still at a federal level to be determined, but it appears there may be some additional funding.
Well, there's a lot of lobbying going on for that, but there's also a lot of other organizations and sectors of the economy that's lobbying for the extra money also, so we'll have to see.
Thank you.
Economic Development Report, Vice President Stabler.
I have nothing further to add.
Okay. Development and Alumni Affairs Report.
I'd like to provide a quick update on the impact of COVID-19 on philanthropy, because I know a lot of people are asking about that. Not surprisingly, March 2020, this last March, was the fundraising results were off, and that was expected. But it was off by more than 50%, so it's really, really a rough month. The good news is that since then, we've come back strong. Both April and May were actually ahead of where we were last year in those months. So that's the good news. Year to date, we are $3.5 million ahead of year to date 2019. So that's the good news. It's sort of interesting to note that the amount that we are ahead is about the same as the amount we raised for COVID-19 related initiatives. So I think that's interesting. Our concern is, of course, going forward, if we'll be able to keep the same pace. Our biggest concern is the pipeline, particularly for individual gifts, and we're worrying that we're not filling that pipeline, not able to get the big requests out there. Most universities are predicting a shortfall from their leadership gifts from individuals in the coming years. So we're working very hard over the summer, keep those conversations going, and try to get proposals in front of people where it's appropriate. Thank you.
We have
I have one question for Vice President Burns. So now that we finished our capital campaign, at what point do we begin to strategize for another capital campaign? What are we? Where are we?
We're actually in the planning process for that right now, and we have a process that's going to be starting this fall to identify the transformational initiatives, big ideas that the university has through our faculty, other sources, to help us identify those priorities for the next year. We expect that we will probably be going into the silent phase of that in the following.
Okay, thank you.
Okay. We have a couple of action items that we need vote on. The first is establishment of endowment funds. Requesting a motion that the Board of Governors establish endowment funds that total $605,505.02 for the purposes presented. Can I have a motion, please?
I'll make that motion.
Okay, I think I saw Governor Busito seconded it, and Governor Kelly made the motion. So we have a proper motion and a second. All in favor?
Aye.
Any against? Okay, thank you. The second is a dissolution of endowment funds. I need a motion that the Board of Governors approve the dissolution of the Undergraduate Library Fund Career Center as described. Can I have a motion?
So moved.
Okay, I got a motion from Governor Stancato, I think, and was there a second?
I'll second it.
Okay, you can choose, Julie.
Okay.
Okay. All in favor?
Aye. Aye. Aye.
Any nays? Okay, great. So we have a proposed schedule of meetings for 2020, 2021, and 2021, 2022. Need a motion that the Board of Governors adopt the proposed meeting schedule as presented. Are there any comments you need to make on that, Julie?
No, just need the action.
Okay. Can I have a motion, please? Governor Busito motions and
Support.
And Governor Kumar supported it. All in favor? Aye.
Aye.
Okay. Any against? Okay, great. Okay, the Secretary received several requests from members of the community to address the board. These individuals will be joining the board in audio format. Each of the speakers will have 3 minutes to present their statements and will receive a 1-minute warning from the Secretary to let them know that their time is almost up. And I will call on these individuals in the order of their requests, orders that we received their requests. The first is Reverend Swan.
I'm here.
Okay, you can go ahead and give your public statement, please.
Good afternoon, and thank you for this opportunity to address the board. I am the mother of a minor-age student who was admitted to Wayne State last fall to the Wayne May Direct program. On January 7, 2020, while fully aware that my 16-year-old daughter was undergoing treatment for depression, Dr. Dominic Barpuller, Mr. Michael Wright, and Dr. Roy Wilson withdrew my daughter from the Wayne Med Direct program against my instructions, and despite medical report that showed that she was undergoing major depressive disorder. Every attempt I made since January 7th to speak with them was met with resistance and silence. And on March 9, 2020, I went to President Wilson's office to seek his input. Mr. Michael Wright came out to inform me there would absolutely be no conversation about the matter. When I informed him that I preferred to wait and speak with President Wilson, about half an hour later, they sent police to come to me and remove me from President Wilson's office on a false charge. At this point, I am really traumatized and baffled and really dismayed and disappointed at what Wayne State has done. They have instead said to my daughter that she's free to be a student in Wayne but not be in her program. We moved all the way from Pennsylvania to enable my daughter take the offer that was made to her, 4 years of undergrad, full tuition and board, and 4 years of med school. We could have stayed behind in Pittsburgh. It has a very good school, take an ordinary education, but I gave up my job to support my child who had just turned 16 2 months before starting at Wayne. At this point, I do not believe that Wayne State is a place that is safe for my daughter to enter.
I was just giving you 1 minute. You have 1 more minute.
Thank you. Thank you. At this time, I am of the conviction that Wayne State is not a safe place for my daughter to be. However, I would like to request that the board order the Wayne Med Direct program in President Wilson's office to reimburse and write a check for my daughter for the full amount that she was promised to attend school so we can go someplace else to continue her education. And also reimburse me the 7 months of salary that I lost while I was waiting here to get a job to support my child in school. And also the amount of monies we lost in paying out of pocket for medical care in the period that we were here. Thank you so much for taking the time to let me address the board.
President Wilson, you're muted.
Okay, sorry about that. Thank you very much, Reverend Swan. Next up is Ms. Elena Hirata.
I'm not sure I see Ms. Hirata online right now, so you could go next to.
Okay, I'll move on to the next person on the list then is Ms. Jane Garcia.
Good afternoon. Can you hear me?
Yes.
Okay. Good afternoon, and thank you. My name is Jane Garcia. I'm from Southwest Detroit. I really would like to make a couple of statements. One is that I'm very appreciative to the professors, and they want to be nameless, that gave several thousands of dollars to the community people and the families that serve over, we served over 400 people, families with diapers and the pens and other things that were not covered by food stamps. They were very devastated with no jobs and not getting to the unemployment situation. And some of the professors stood up and came over to the agency and provided financial assistance to some of these families. And I just want to make sure that you all know that we have some great leaders in Wayne State, and I really appreciate it on behalf of the Board of Directors. I also am very concerned about what's going to happen in the future to the medical students and the medical plan, and I'm hoping the Board of Directors will come up with a plan for the future that would benefit our community, our students, and the state. Muchísimas gracias.
Thank you very much, Ms. Garcia. Is Elena Hirata online yet?
I do not see.
Okay.
I do not see.
Okay, we'll move on then to Ms. Isabella Warmbrun.
Hello, can everyone hear me?
Yes.
Sorry, I'm here on behalf of presenting this petition on getting Juneteenth to be recognized as a university holiday. I did submit slides that you can review. I'll just go over some main points. I know that there's a lot of debate on if this can be made into a university holiday. However, as I mentioned in the slide, it's already been recognized by a lot of different organizations and corporations. And as of this morning, actually, there's been a proposal in the Senate to try to make it a national or federal holiday. I don't really know if there's any arguments that the board can make on this matter on why it shouldn't be a holiday, but I'll present the results from the petition. I had almost 300 results or response as of this morning, and overwhelmingly 99% of the people who have responded have agreed it should be a holiday. The response demographics include current students as well as staff and faculty, alumni, and also prospective students. I really feel like this is an opportunity for Wayne State to be on the correct side of history. Juneteenth is a celebration of the ending of slavery, and I think that it's something that really should be recognized as a university that is located in Detroit, which is one of the largest Black populations. As a student of color here at this university, I feel like it'd be really encouraging, instead of putting out statements from the university referencing Black artists or saying that you stand in solidarity, by actually doing something that has some substantial action behind it. This has already been done for entire states, including Texas, New York, and Virginia, and as I'm sure all of you can agree, Wayne State does not have more employees in the state of Texas, so I really don't think that logistically this is something that is that difficult to complete. Again, I really hope that you guys do something more substantial and something with more action behind it besides just saying you're in solidarity. Juneteenth, again, is a very big deal for a lot of students, and I think that it should be recognized. Thank you.
Thank you very much, Ms. Warmbrum.
Can I just ask something? Because I agree with what the speaker said, and I think this is an opportunity for the university to lead on this particular issue. And, you know, especially if we are saying that we are committed to diversity, equity, and inclusion, this is low-hanging fruit.
I agree as well.
Well, thank you very much, Ms. Warmbrum. I'm sure we will take this up very seriously, and we appreciate the passion and the conviction of our students, and appreciate you bringing this up. Thank you.
Thank you.
Roy, I'd like to ask Governor Kelly, our board chair, Marilyn, could we put this on our next agenda for our next meeting or our next executive meeting so we can discuss this? I don't really think that this is going to be a big issue for us. I suspect it's not going to be a big issue. I think with a lot of organizations, you know, the NFL and Target and all these other corporations now coming out and doing this, these are all good first steps. But I think there's, you know, we also have to look at the underlying policies of our university and making sure that our policies here support our Black faculty and support our Black students. And so
we can certainly put it on the agenda. Right. No problem.
Thank you.
Okay, great. While we got through the day, there'll be no further business. Motion to adjourn would be in order. Can I get a motion?
So moved.
So moved. Okay, great. I think I saw a second, and so I'm going to take that by acclamation. We're adjourned. Thank you very much.
Thank you.